Yeah, my name's Scott Cunningham. As Andrew says there, I'm Senior Lecturer at Dundee University and CTO of MyDiabetesMyWay and co-founder. I've been developing computer systems for diabetes for over 20 years now, initially with the National Electronic Record for Diabetes, which is called Sky Diabetes. And this is a record that the healthcare team had access or have access to and have done for about 15 years or so now. Over the last 10 years, kind of turned our focus to what we can do to give patients access to that same data resources as well. So just to give you an idea of the types of data that we're dealing with here. So we collect data from all of the GP practice systems across Scotland. We collect data from secondary care labs, specialist clinics, specialist screening services, and we basically try and pull it all into one place so that anybody who is involved in the management of people with diabetes, whether it be within the healthcare team or within the patients themselves, have access to effectively a shared electronic record. I'm primarily here to talk about MyDiabetesMyWay. So this is kind of unusual. This started off as a research project that has gradually grown to become the national patient-facing platform in Scotland for diabetes. And basically it's a website and mobile app that patients and carers can use. It's got all sorts of information leaflets on there and other interactive content to allow people to learn more about diabetes and how you can sort of develop or avoid the development of complications of the condition. We have lots of content that we've developed within the health service in Scotland and lots of information that we link to from other relevant sites like Diabetes UK and the WHO and so on. And the site as it stands has been live since October 2008. What has happened and what we're about to do is celebrate our 10-year anniversary of actually giving patients access to their own data. So the 15th of December 2010 was when we launched the patient-facing records access platform. So what we've tried to do is to give people access to information that's the sort of key diabetes markers that we want people to understand more about, like blood pressure, cholesterol, HbA1c, and so on, and give people the tools and knowledge to more effectively manage their condition. So as I said, this has been live for 10 years now. Anybody with diabetes in Scotland can register to use the service, and it gives people access to their test results, to any assessments that may have been taken, like foot or eye tests. People have access to all of their prescribing data. And people can also now contribute to their own data as well. So in addition to manually entering results, which some people do, we also link into a number of integration systems like DiaSend, Tidepool, where we can actually bring in data from a number of the diabetes devices on the market, so blood glucose meters and so on. More recently, we've been connecting into activity data and also linking into patient-reported outcome measures, so we can bring in that data in near real time to allow us to hopefully give people the tools that they need to more effectively manage their condition. So what we've seen, we have this 10-year evidence base, which I suppose is quite unusual for new products on the market, but because the service has been running in Scotland for 10 years, we have this evidence base where people can say we've seen improvements in clinical test results. People tell us that they're more motivated to make positive lifestyle changes and have more productive consultations with their healthcare team. And in terms of health economic benefits, we've seen a 5-to-1 return on investment for all of the funding that's been pushed into the development and management of the service so far. So really this whole works with the University of Dundee. Every time we were presenting at conferences, people were asking us, can we get this in our area? And ultimately that's why we span out MyWay Digital Health from the University of Dundee. As Andrew mentioned, we've been implementing the service beyond Scotland now. We cover about a quarter of NHS England in terms of population of people with diabetes. And we've got services running in North West London, Greater Manchester, and the North West Coast, amongst others. We've been part of an NHS Innovation Accelerator, which has helped get us in front of the right commissioners. And that's been really useful. And we've also started implementing in the Middle East. So we've got 2 projects running just now, one in Saudi Arabia and one in the United Arab Emirates. We've actually got our first international member of staff, who's our business development manager, who is based in Dubai. In terms of current developments, and just to finish off, some of the work that we're doing is again around further personal device integration and bringing all that information that you can collect from personal devices and linking that in with the traditional health service information. And we've got a number of projects working on developing new artificial intelligence and machine learning models to hopefully try and risk stratify people more effectively so that they are receiving the most appropriate care from their healthcare team. And with that, I will stop.
Scott, thank you very much. I'm going to ask you two questions. The first one is, how do you measure outcomes? So you have an outcome clearly for MyDiabetesMyWay, and it's being accepted in many different locations. And that's interesting about the Middle East, because there's a huge prevalence of diabetes there, as there is around the world. I direct people to the rule of halves, which is something that guides a lot of thinking around diabetes. So people can look that one up. But so how do you measure outcomes in terms of patients and the benefit that they get? And secondly, and I probably could have mentioned it in my introduction, but it's the use of artificial intelligence. How is that sort of feeding its way into your app? Because, you know, IBM, you know, clearly artificial intelligence is a huge part of what we do. We see it being infused in almost everything, healthcare, not everything, but significant amount of things, healthcare related and other related. So can you talk specifically to those two things as it relates to, you know, my way?
Yeah, so in terms of the outcomes measurement, so we obviously look at the clinical test results, and we have done analysis of data prior to a person accessing the records online, and then doing comparisons over the months and years beyond that. One of the main analysis, and the health economics analysis in particular, that I was leading up on, looked at the cohort of people who had accessed MyDiabetesMyWay for at least 3 years, so we had some element of impact on clinical outcomes, and we compared that to a matched cohort of people within the Scottish diabetes population, matched by gender, age, socioeconomic status, and other demographic factors, and then compared the sort of clinical performance in terms of HbA1c, blood pressure, cholesterol, and other test results to see what impact that had. So the people using the MyDiabetesMyWay service had much better sort of short-term health outcomes. And using something called the United Kingdom Prospective Diabetes Study Model, we were able to plug in our data into that analysis. And that was based on, that's something that came out of Oxford University, based on a 30-year prospective diabetes study. And it's got this spreadsheet-based model that you can plug your data into, and it gives you a health economics analysis. So we're able to show that people who are using MyDiabetesMyWay, based on the data we've collected, they are showing sort of avoidance or delay in capturing the long-term complications of diabetes in terms of eye disease and foot disease and cardiovascular disease, amongst others. So people using the service are controlling their diabetes better. And people actually tell us that as well. We've done a number of surveys with the patients who explain to us that they have much better consultations with their healthcare team because they understand the results better, and they're able to have a much sort of more fruitful conversation with their team. Moving on to the second point about the AI and the machine learning. So we've actually got a project funded just now through Innovate UK, which is one of the digital health technology catalyst programs. And what we've been doing is looking at validating existing models for risk prediction that are in the literature, but also looking to come up with new models based on all of the data that I've talked about just now. One of the ways, and we've had a number of focus groups with patients and with healthcare professionals to look at, okay, it's one thing generating the figures from these models, but how do we actually present it back in a way that's usable, that's interpretable, and understand it, and make the appropriate choices based on how they're getting on. So one of the things that we do is, within the new models, is we've got sort of slider-based systems. So if we give people their current parameters and say, okay, move the slider along to say, if I lose 5 kilograms, what does that mean in terms of my risk profile, effectively? So we're doing that on an individual level for the patients, and healthcare professionals can access that for each individual patient as well. But the healthcare team can also analyze data based on their own population. So we've got dashboards that we've been developing to allow people to assess their clinical cohort.